Lilian Azzopardi. I'm a professor and head of Department of Pharmacy. I was attracted to this profession as a very young child when I visited the community pharmacy run by my grandfather. I'm glad to be contributing to improving pharmaceutical services in our local community, but also through my international collaborations and participation in other associations. So herd immunity is an approach which is taken in to reduce the sites where an infectious organism, in this case the virus, can come into contact with a host, meaning that we are reducing the possibilities of a virus which needs a living organism to maintain its virility. So we are reducing the possibility of this virus to find a human host and then create the infection. So the term comes from this concept of trying to produce immunity in a population and reduce the possibility of the virus to find a host. So why is it important? It's important because that's the way we can fight the infectious diseases, in this case coronavirus. By creating herd immunity, we will reduce the options for the virus to go around human beings, get into the system and create an infection and then get transmitted to someone else. If we look at some infectious diseases, in fact there is a historical reference to smallpox. Smallpox was an infectious disease which was actually one of the first reasons how vaccination and the whole vaccinology concept kicked in during the time of Jenner. And smallpox was actually eradicated by having this approach of a herd immunity, of vaccinating. And nowadays the WHO has, for the past number of years, declared we are smallpox free. Vitamin D, it's a supplement which we know that it has an influence not only on bones, which many probably associate the vitamin D with bones, but there's also a value of vitamin D, how it interferes with genes related with the reaction of immunity. So scientifically, there is a basis how vitamin D is interplaying in how the body reacts to a virus. There are also a number of studies which have been issued since March, which have shown that there could be a correlation where persons who had a lower vitamin D levels or were vitamin D deficient had a higher risk of developing the disease or the complications. But this is a correlation, and the factors are also other factors that we know increase the disease itself, like the obesity and other factors. So it is still not clear, but at this stage a number of studies have indicated that supplementation, especially when we know vitamin D is activated in the body by the sun. So in countries where there's not so much sunlight, sun exposure, or during the winter, supplementation as a food supplement, not in exaggerated amounts, could be considered. I think what's in the Department of Pharmacy, a large proportion of our research focus is dedicated to what we refer to as practice research, meaning how are we optimizing services, pharmaceutical services, to get the patient access to quality, safe and effective medications. So the vitamin D is an example, but we have other studies, other aspects which we are looking into. For example, the aspect of vaccinology, looking at the development of the COVID vaccines and reflecting on the science of those COVID vaccines, and more importantly on the processes that we're looking at the regulation of those vaccines. Many individuals are concerned. Normally a vaccine takes 5 years to develop. How come these came up with the vaccine in about 10 months? So the science behind our research is looking at exposing how the regulatory processes could be streamlined so that the same approach, while maintaining safety, can be adopted to other vaccines and other innovations and developments of medicines. I've been looking into the science behind the vaccines. I've looked at the process that they were scrutinized from a regulatory point of view in terms of the safety profile and also the effectiveness. And I can say that as a pharmacist, look, by evaluating that science, I myself personally would take the vaccine as soon as I'm called up for it, and I advocate that all of us will do so, because from the data that has been presented till now, it is shown that there was robustness in the approach to develop the vaccines, and also that the trials that have been put forward demonstrate that in this current position we have safety and effectiveness explained from a scientific point of view.